They've been looking at this since about 2011 as its own entity. Obviously, it's been around since long before 2011. But they looked at bloating within irritable bowel syndrome back then, and of course 60 to 90% reported it as the most bothersome symptom. So if you look at the people with IBS and then you poll them, the large amount of the IBS population is having issues with bloating and distension, especially in perimenopause. There's a lot of cognitive hypervigilance, and there's a lot of adverse events that are associated with this. So when we think about IBS, the most interesting thing to think about is that generally people don't just get IBS, or they don't start having symptoms, IBS-C type symptoms. It's not a diagnosis, it's a category, right? I have to say that every person that I've had in the last 15 years for sure, every client that I had that was presenting with IBS symptoms, when I track back with them as to when the symptoms start, and you start asking questions about that time period, you're going to find what's going on. Generally, it's come after things as interesting as a virus or a death of a loved one, and anything in between. Because of the stress response that the system undergoes, the system bypasses its adaptive response and it moves into these kinds of chronic situations here. And it oftentimes doesn't happen until at least 6 months to a year following the crisis. So I find that pretty interesting, because the other story is the most difficult clients that I also have had to treat are the ones with severe external anal sphincter spasms. Or in other words, it's just like the anismus group. And most of the ones that I had the privilege of seeing, I started learning about this back in the days when I was working in the head injury unit in Louisiana. And it was very interesting because it was the first time that we were doing the Craig beds and the Glasgow scale was going on. But we were treating these people who were surviving at the time and then that was trying to learn to thrive. And one of the biggest issues they had was anismus. Could not go to the bathroom at all. We know this already, right? But I think it's nice to kind of triangulate the stories and pull them in, because a big piece of what we can do to help people is really help them regulate their nervous system. We can help with the physical piece, but at the same time, we got to look at the nervous system too, which is why I love this cognitive hypervigilance and adverse effects. Even from 2011, they were starting to talk about that.